driving up the 101 and entering Crescent City, I was like, wow, yeah, this feels like special.
There's a good work-life balance here. And that was the main thing that was missing from my previous employment.
I got here as a traveler and then just started being part of the community.
When I came here about a decade ago, I thought I would stay here a couple of years.
Kind of fell in love with the place.
I always say once we can get somebody here, we stand a strong chance of keeping them.
This year was my 25th anniversary. The sunsets are magnificent.
It's not often you get to work and live in a place that most people come to vacation in.
We have many people that have come on traveler assignment. And guess what? Now they've been employees of Sutter Coast for 20. It's a hidden jewel.
I was like, well, I want to buy a house. Houses on coasts in California are ridiculous. I got this for the price of a condo.
This is real rural medicine. You might have one patient who crashes their motorcycle into an elk, and that's room one. And then the next patient you see has diabetes, and the next one pneumonia. You can never really predict what's going to happen out here, and the stories are incredible.
We have a significant shortage of physicians, but especially primary care. I'm the only obstetrician in the entire county.
We are hungry for physicians coming here. People's offices are overrun because there's not enough providers to see the patients here.
When the opportunity presented itself to us that we could have residents here at Sutter Coast, it meant that we were going to be able to improve access to care for our community.
In order to be able to take care of that rural population, residents really need to see a lot of the higher acuity things that you would see at this trauma center in Sacramento. And then starting in their second year, they'll go up to Crescent City.
So I've been up in Crescent City. I've mostly been rotating outpatient. The availability of the specialists and how open they are to teach is awesome. You get to try things. They're there to walk you through it if you need it.
You're going to be changing lives. It sounds like such a small phrase, but when you're actually changing somebody's life and that's affecting generations down, I mean, that's something to be proud of. And you get to participate in that in a rural community.
This is a place where the hospital, the staff, the facility, it all works. And the idea of being able to teach residents, that's fantastic. Anybody who comes up here, you're going to grow.
Every one of our doctors who comes to this community is filling an absolutely essential role. Residents are uniquely and specially equipped because they get to see this incredibly broad scope, anything that walks through the door.
What I was and what I am right now, it's like completely different. The team is what keeps me here.
Nature can be medicine. Getting out of clinic and then do a new hike every day has been awesome.
There's something magical about taking a hike amongst 3,000-year-old trees where you understand how small you are compared to that.
To see the water move is good enough for you to heal and come back to provide care for those who need it. I would love to see more doctors coming here to join us in our wonderful adventure.